In this video, here's what we'll cover: what couples counseling really is, the patterns that keep couples stuck, what the evidence actually shows, 2 proven approaches, EFT and the Gottman Method, your first session, and when to reach out. You know how it starts. A comment about the dishes, a tone of voice, a silence that lasts a little too long. Before you know it, you are back in the exact same argument you had last month. And the month before that, you both say things you regret. Then you retreat to opposite corners of the house, wondering how it got to this point. If that sounds familiar, I want you to hear one thing first. You love each other. That is usually not in question. But love on its own does not dissolve the patterns that have hardened between two people. It does not repair the resentment that builds when the same wound keeps getting reopened. And it does not restore that feeling of being truly known by the person across the dinner table. The good news is that these patterns can change. Let me walk you through how. So, what is couples counseling? Really, it is a structured form of psychological support, where both partners work with a trained therapist to understand their relationship patterns, improve communication, and rebuild connection. It is not about deciding who is right. A good therapist does not take sides. Instead, I help you both see the relationship as a system, so you can notice how one person's behavior triggers the others, and how those cycles keep you stuck. In my practice, sessions usually run for 50 to 60 minutes, weekly or fortnightly. And telehealth is available for couples right across New South Wales. The process often begins with a joint session where you both share your perspective. Then each partner may come in on their own, so I get a fuller picture. From there we settle into ongoing joint work, with small practices to try between sessions, like active listening or protected time to reconnect. Now, you do not need to be in crisis to benefit from this. Research points to a wide range of reasons couples reach out. One of the most common and best studied is a demand withdrawal cycle. One partner presses for connection or resolution, and the other pulls away. The more one pushes, the more the other retreats, and both of you end up frustrated and unseen. This pattern is known to predict relationships drifting apart over time. Another common one is emotional disconnection. These are couples who function beautifully as parents, housemates, and co-managers of a busy life, but who have lost the sense of being genuinely close. They feel more like business partners and companions. Other reasons include recurring arguments that never resolve, a breakdown in trust, differences over parenting, big life transitions, or the pressures many families here in the Hills District carry, from the cost of living to long commutes and high expectations. Let me be clear about the evidence, because it matters. Couples therapy has a strong research base. A large meta-analysis pulling together dozens of studies found a big improvement in relationship satisfaction compared with no treatment, and those gains held up at follow-up, while couples left on a waiting list showed no real change. One well-researched approach called emotionally focused therapy has been reviewed across many studies involving hundreds of couples. Researchers found medium to large improvements from before treatment to after. Around 7 in 10 couples were free of relationship distress by the end, and the gains lasted for up to 2 years. For couples recovering from infidelity, a recent controlled trial found the Gottman Method worked better than usual care for rebuilding trust, managing conflict, and restoring closeness. These are not small or fleeting effects. Let me tell you a little about those 2 approaches. Emotionally focused therapy, developed by Dr. Sue Johnson, is grounded in attachment theory, the science of how we form close bonds. Its core insight is simple but powerful. Underneath most arguments sits an attachment need that is not being met. The anger, the withdrawal, the criticism. These are often protective responses to feeling unsafe or unseen. So together we identify the negative cycle, uncover the softer feelings beneath it, and help you express those needs in a way your partner can actually hear. The Gottman Method draws on more than 40 years of research into what sets thriving relationships apart. It names the communication habits that reliably predict breakdown, criticism, contempt, defensiveness, and stonewalling. Then it rebuilds the relationship, one skill at a time, by helping you know your partner's inner world, turn toward their small bits for connection, and manage conflict in a way that brings you closer rather than further apart. Many couples feel nervous before that first session, and that is completely normal. The first session is a joint one, where I listen to both of you, not to judge who is right, but to understand the patterns at play. The pace is yours, and there is no pressure to share more than you're ready to. If this is speaking to you, please know that couples counseling is not a last resort. It is a proactive investment in one of the most important parts of your life, and earlier is genuinely better. If there is any safety concern in your relationship, please reach out to a domestic and family violence service first. Otherwise, you can read the full guide or book a session with our Bella Vista practice, Potentialz Unlimited, using the links in the description below. Before you go, here's a quick recap of what we covered. What couples counseling really is, the patterns that keep couples stuck, what the evidence actually shows, 2 proven approaches, EFT and the Gottman Method, your first session, and when to reach out.